The Joint Services Review is a review of the services we provide in the acute trust, and it will also look at the effects of any changes we make to those acute services in terms of the community, so we have a joined up picture that we can actually implement. We're actually looking at all services in the acute trust, but we've actually broken down the services into groups which will be looked at by clinical working groups, and these are elective, and that means when you come for a scheduled operation or you come for an outpatient appointment, the routine and planned work essentially. We're looking at emergency care, which is the care largely when you need admission because you're acutely ill, you suddenly need to go to A&E, and you have to go through the emergency part of the hospital. We're looking at women's and children's care, so this is care for pregnant women, delivering babies, and indeed children, paediatrics and the care of children, whether that be emergency or they plan to come in for an operation. Then finally, and this relates to some of the reasons behind the review, we're looking at care for the elderly. As the population gets older, actually now the majority of people in our hospital are over 65, and we need to look at making sure that they're only in hospital when they need to be, they get out to good home care as soon as possible, and indeed we treat older people with the dignity and respect they deserve, and particularly we look at dementia care. The other really big pressure is around junior doctors. You may have heard about the reduction in junior doctors' hours, but certainly when I trained, junior doctors were in the hospital for very, very long hours. That's been reduced. And we've also have subspecialisation. You know, if you look at the treatment of heart attacks and strokes, for example, whereas a heart attack was treated by a general medical doctor, now patients have the right to expect to see a cardiologist. We open arteries, in block coronary arteries, to treat heart attacks. And that means you've got to have a lot more specialists. To get all those doctors together and provide a comprehensive service, you need bigger units, and that's the dilemma we face, the pressure between centralisation and having all the specialists and the desire everybody has to have services as local as possible. Patients are vital throughout this process. We will have patient representation at all parts, and I think the worry a lot of people have is when they hear about service reviews, they think about changes to their local hospital. We're very much starting with trying to work out what the right thing to do is, what's best for patients, and then when we've worked out what we're trying to do, we'll go into where it might happen. We really don't know the outcome. There is no done deal. We have to work through this in a logical way, decide what's best and best for patients, and then decide where it might be. I'm sure that we will make some changes that will not please everybody. That's for sure in any of this process. But we're really trying as clinicians to do what we can within the resources available and the constraints we have.